Definition: feeling sick and vomiting are common indicators that can be caused by numerous problems. Nausea and vomiting frequently are due to viral gastroenteritis, often mistakenly named stomach flu, or maybe the morning sickness of early-on pregnancy. Many medications could cause nausea and vomiting, since can general anesthesia regarding surgery. Rarely, nausea and also vomiting may indicate a critical or even life-threatening problem. Will cause: nausea and vomiting may possibly occur separately or collectively. Common causes include the chemotherapy, gastroparesis, a condition in that the muscles of the stomach wall structure don't function properly, affecting digestion, general anesthesia, intestinal obstruction, care at Mayo Clinic, morning sickness, action sickness, first aid, rotavirus, viral gastroenteritis, stomach flu, vestibular neuritis. Other possible factors behind nausea and vomiting contain alcohol use disorder, anaphylaxis, anorexia nervosa, appendicitis, not cancerous paroxysmal positional vertigo, BPPV, brain tumor, bulimia nervosa, cholecystitis, Crohn's disease, cyclic vomiting syndrome, depression, major depressive disorder, diabetic ketoacidosis, dizziness, ear infection, middle ear, enlarged spleen, splenomegaly, a fever, food poisoning, gallstones, generalized anxiety disorder, GERD, gastroesophageal float disease, heart attack, heart disappointment, hepatitis, hiatal hernia, hydrocephalus, hyperparathyroidism, overactive parathyroid, hyperthyroidism, overactive thyroid, hypoparathyroidism, underactive parathyroid, intestinal ischemia, intestinal obstruction, intracranial hematoma, intussusception, in children, irritable digestive tract syndrome. Medications, including aspirin, nonsteroidal anti-inflammatories, oral contraceptives, digitalis, narcotics and antibiotics. Meniere's disease, meningitis, milk allergy or intolerance, pancreatic cancer, pancreatitis, peptic ulcer, pseudotumor cerebri, pyloric stenosis, in infants, radiation therapy, severe pain, toxin consumption. When to see a doctor. Phone 911 or emergency medical assistance. Seek prompt medical attention when nausea and vomiting are usually accompanied by other warning signs, like chest pain, severe abdominal soreness or cramping, blurred perspective, confusion, high fever and also stiff neck, fecal material or perhaps fecal odor in the BSIC, rectal bleeding. Seek quick medical attention. Ask someone to drive you to urgent care or perhaps an emergency room if feeling sick and vomiting are combined with pain or a severe headaches, especially if you haven't had this sort of headache before. You have signs of dehydration, extreme thirst, dry mouth, irregular urination, dark-colored urine and also weakness, or dizziness or perhaps lightheadedness upon standing. Your current vomit contains blood, appears like coffee grounds or will be green. Schedule a surgeon's visit. Make an appointment with your doctor when vomiting lasts more than 2 days for adults, 24 hours for the kids under age 2 or perhaps 12 hours for infants. You have had bouts of feeling sick and vomiting for more time than 1 month. You've knowledgeable unexplained weight loss along with feeling sick and vomiting. Take self-care measures while you wait for your current appointment with your doctor. Relax. Too much activity and not having enough rest might make feeling sick worse. Stay hydrated. Consider small sips of cool, clear, carbonated or bad drinks, such as ginger light beer, lemonade and water. Clean tea also may help. Oral rehydration solutions, such as Pedialyte, can certainly help in preventing dehydration. Stay away from strong odors and other triggers. Food and cooking smells, perfume, fumes, stuffy rooms, heat, dampness, flickering lights, and generating are among the possible sets-off of nausea or vomiting. Eat bland foods. Focus on easily digested foods like gelatin, crackers and bread toasted. When you can keep these lower, try cereal, rice, fruits, and salty or high-protein, high-carbohydrate foods. Avoid oily or spicy foods. Hang on to eat solid foods until concerning 6 hours after the previous time you vomited. Make use of over-the-counter, OTC, motion disease medicines. If you're planning a visit, OTC motion sickness medications, such as dimenhydrinate, Dramamine, or perhaps meclizine, rugby travel sickness, may help calm your queasy stomach. For longer travels, such as a cruise, ask your medical professional about prescription motion disease adhesive patches, such as scopolamine, Transderm Shop. If your current queasiness stems from pregnancy, try out nibbling on some Termkins before you get out of bed in the morning.